So my epilepsy surgery worked and then it didn't. For a little brief story for you. So in August 2024 I had a procedure called LITT, or LITT, you know. It stands for laser interstitial thermal therapy, and what it means is that they basically heat up a little bit of your brain, sort of so hot that it then causes tissue necrosis, and that's what they did with the bit that had showed up on my intracranial EEG as being my seizure focus, you know. So intracranial EEGs, they're not fun. You know, they have to sort of shave all your hair off and they stick various wires in your head to record seizures, you know. So I had 12 wires in total, I think, and that was back in 2019, so yeah, most of the hair's back. But yeah, I had that operation in August 24, and sort of, it was about a 10-hour operation. It went on for a long time. Yeah, no, I sort of came to in recovery, and they were amazing. Can't fault the hospital staff, you know. They were sort of very kind, and the recovery room, it's a very dark room because your eyes are very sensitive after brain surgery. And sort of they were sort of very kind, sort of made sure that my faculties were all working, because obviously they've been digging around in quite a sensitive area. So I just don't mind Daisy. But yeah, so that happened, and at that point it felt like something had just been cut, you know, no more seizures, and it was honestly the best feeling of my entire life. But yeah, so I gradually started reducing medication on the advice of my neurologist. You know, don't just stop doing these things yourself. And sort of I was getting out and about in my local high street on my own, which was amazing, you know, to actually get some independence. But then I started having some slightly funny dizzy spells, you know. I was just like, it's not a seizure, I don't have epilepsy anymore, you know. So you just sort of like push it away, you know. And sort of I got like a couple more of these, and you're just like, oh, I'm just having a blood sugar crash, you know. It's nothing too dramatic. I did once have someone say to me, I was like, I think you've had a seizure. I'm like, oh no, I must have just dozed off or something, you know. And it's sort of, you get very wary that actually maybe this hasn't worked. And so I sort of mentioned it to my neurologist, and he was like, okay, reverse the last medication reduction you did, so sort of you're going back up a little bit. So I did that, and a couple of weeks sort of later, so we're now 4 months on from the surgery, so I had sort of severe eye pain because I think the nerve was damaged, so that was a bit annoying, but it's gradually got better and it's most of the way there now, like 18 months on. Anyway, we come to around 4 months post-op, and it was sort of gone to bed normal, hadn't done anything ridiculous like gone out drinking or whatever, just normal evening. And suddenly I wake up at about 5 AM in the morning, and I've got 2 paramedics sort of like looking at me a little bit concerned, and I'm like, why are you in my bedroom? Like, why are you here? And they kept saying to me like, you've had a seizure, are you okay? And they were lovely. Again, can't fault them. I can't fault any paramedics I've ever had. And I could see my husband Carl sort of in the background, who was looking a little bit worried but glad that I was awake. And they kept saying to me, no, you've had a seizure. And I'm looking, I'm like, don't be silly, I'm not epileptic. And this went on for a good 5-10 minutes. Again, can't fault their patients, they were amazing. And eventually something's just clicked, and I've gone, oh no, like the seizures are back. And then they came back with a fashion, you know. It was like, got to be dramatic, haven't you? But yeah, no, something clicked, and I realised that yes, I had a tonic-clonic seizure, and yes, the seizures were back, and I just burst into tears. And sort of emotionally, I still really haven't been able to recover from that, because all that independence and confidence I'd slowly built up, you know, that was just gone. Like, in an instant, you know. And that was hard. And it's sort of, in those 4 months, everyone's just like, oh my god, this is amazing, you've tried this revolutionary surgery, which again, can't fault the surgeons, anything like that, not at all. I was speaking at events, I was speaking on podcasts, and people were saying, you're doing so well considering you've just had brain surgery. And I was just, oh, you know, it's minimally invasive, that's good. But what's suspected to have happened is that sort of during my intracranial EEG, so when they measured sort of with all those wires and stuff back in 2019, they said that I had sort of a little bit of electricity elsewhere, but it wasn't enough to cause a seizure. And I think, personally, my thoughts on what's happened is that after they destroyed the bit that definitely causes the seizures, they then, those electrical bits sort of buzzing around that I mentioned, I think what's happened is they've got stronger. And so my neurologist, he sent me for like this, not an experimental scan, but sort of a scan that wasn't readily available on the NHS. I think it's called a MEG scan, so MEG. I don't remember exactly what the long word is, it was a very long word. And sort of I sort of sat in the scan, it was like a big old fashioned hairdryer's helmet, and they got me to sort of do like a quiz as I was sort of going through the scan. And I think they said that's to make sure that my brain's like working to try and solve the problems. And this scan basically showed that my epilepsy was coming from 3 areas now. So what that meant was that I was no longer eligible for the targeted operation that I'd had before, the LITT surgery. And that was a hard one, because I was just so, what am I supposed to do? And I think that's a lot of things people don't talk about. It's sort of, you put all your hope, all your faith into this surgery working, and then when it doesn't, what do you do? You know, and you're sort of stuck in a bit of a void, almost, you know. So even when I'm taking cluster medication, so I take clobazam for clusters, so I don't take it routinely, I take it as and when needed, when my seizures are particularly bad. Even that's starting to not work now, because I'm medication resistant, I think the word is. So it basically means that my medication doesn't stop my seizures, but I have to continue taking it to try and keep the tonic-clonics at bay, so like the classic convulsive seizures, you know. And I have been offered to sort of be put on a waiting list for a new implanted device. I think it's called EASE, so EASEE. But just the very thought of having something sort of like implanted and then left in me is something really scary. I mean, brain surgery itself is terrifying, you know. But with the LITT surgery, it was sort of, okay, we're going to sort of basically blow this bit up and hopefully this fixes you. And for those 4 months, I did think it had worked. But the idea of having something left inside that you then have to change batteries on every 3 years, that's a decision I'm still coming to terms with, you know. But no, I hope that this video has helped someone out there who maybe has been through a similar situation as myself, and maybe has had surgery that's not worked, or just needs sort of to know that maybe someone else has had the same problem, you know. But yeah, no, do keep the sort of ideas coming in, and I am happy to talk about pretty much anything epilepsy related, just because I've had it for about 16 years now, I think. Yeah, about 16 years. So I like to consider myself a fairly pro in terms of being an epilepsy patient. And I am making an effort to sort of write all these sort of things down. So maybe one day it'll turn into a book, you never know. But yeah, and hopefully you enjoyed the usual sort of. So you've got to say hello to Daisy quickly. Say hello to Daisy before we go. She's having a little doze. Okay, right. I will let you go. And yeah, hope to see you next time. Right, bye.